We do not offer every plan available in your area. Currently, we represent approximately 15 organizations which offer over 100 products nationwide. Please contact Medicare.gov or your local state health insurance program to get information on all of your options. This newsletter, Jay's Corner, jo.substack.com. You can get links below. There's a free version, there's a paid version. And the reason for it is here, which is that, what happens is when you come, it allows you to get access to other articles, videos, insight on how much noise there actually is on the planet. Now, I don't know this person, right? Lots of followers, etc., etc. Why is health insurance so damn complicated? Just put universal health care through already so we can stop this bullshit. I pay more in taxes. Okay. And here is exactly why I have these videos. You'll pay more in taxes, but guess what? You need to be elected in order to be in a spot to enact whatever your philosophy to be. You need to be elected in order to enact taxes. You're Miss Perfect, you live in a shoe, you have so many children, you don't know what to do. You have $0 to pay for extra taxes. You're not, from a practical point of view, you're not electing the person to enact this stuff. Common sense, practical reality. It's not because I'm necessarily agreeing or disagreeing here. The reality is healthcare delivery, so complicated. You can take any side. I don't care. We'll debate for 20 hours. We will be exactly where we started. The issue here is not only is this impractical, but it gets mixed up with things that make complete sense. This is another post from the same person, which is to choose people who are good for your mental health, which is not wrong necessarily, except for the issue is that the person is saying, okay, choose people who are good for your mental health. Doesn't that mean that the person has to have some common sense? You can understand how mixed it might be. On to the show. Medicare annual election period ends December 7th. No doubt about that. You can click Maximize Your Medicare, the website for the book. If you still need guidance, there's a very few number of days. Do I think that there are going to continue to be headlines to say this, that, or the other? I don't think there's any doubt. We are not getting away from the fact of number one choice being Medigap and Medicare Advantage. Let's leave out the complications for enrollment. Let's leave that out for now, right? We've got an entire website to deal with that. Entire website to educate people on how to get enrolled, when the right timing is, who the situations might be where your timing would be different. It's going to vary. People are not working only to 65 and then immediately going on to Medicare and retiring, because full retirement age under Social Security is no longer 65 years old. Over here, for paid subscriber, they get access to this spreadsheet, which has all the different issues that we've discussed here on videos, etc. Right? A lot of them, complicated ones, no question, but the point is, it's not that simple to just simply say, and I've seen this online, of course, oh, well, all I do is contact Medicare.gov. The world isn't as simple as that. Issues are not as simple as that. And you can see, this is what I was saying, which is that this type of headline is going to continue. We are not getting away from that. In fact, United Healthcare announced the other day that something like 90,000 physicians are employees of United Healthcare now. That United Healthcare now owns and is the employer of 90,000 physicians around the country. This is not to single out United Healthcare. It happens to be the largest carrier. There are going to be other carriers that are also involved in very similar activities. We're not getting away from that. It does complicate things because of the fact of the different agendas and the crossfire. It's just giving you an illustration of how complicated healthcare delivery in the United States is. Before I get on the high horse of people getting on the high horse, well, it doesn't exist this way in other countries. And then they come up with all these different statistics. I'm going to go back to the idea of this, which is that, it's this complicated because this thing that would require a different tax setup, which that's why I started today in this way, circling back after what, less than 11 minutes, which is, yeah, sure. If you had that philosophical thought, then you have to have the practical execution of that thought. Not possible in the United States. So as a result, the over there, it works this way. Over there, it's great. I've got a fifth cousin who has this other, setup. Yeah, you can't have that here because you have to pay more in taxes. And again, I'm not interested in those kind of positions where I get a vote or even, try to influence it because I already know the fact that, and I could fix it, maybe, but I promise you that the solutions would affect some of the huge stakeholders to such a degree, my car would mysteriously drive off the side of a mountain. Yeah, that is, absolutely the case. Anyway, back to December 7th. Over here, I'm going to tell you about one other thing here, which should have been included here, which is Q1. Medicare Advantage plan members have an additional option. Now, you need to be an existing member. So you have Medicare Advantage Plan 300. Can you switch to Medicare Advantage Plan 200? Yes, you can anytime between now and December 7th. You can also switch during quarter one. You can also cancel during Q1 from your existing Medicare Advantage plan. You can cancel it entirely and return to original Medicare. And at that time, try to get to Medigap. The answer to that is yes. But tons of other videos to tell you from me, which is to say that you need to be very, very careful here because you are exposing yourself to not having health care coverage under Medicare beyond a certain point, which is that you have unlimited financial downside. When you see all these other things about cost overruns, Medicare Advantage costs too much. This largely ignores the fact that there must be an out-of-pocket maximum. I'm not here to settle this, right? I'm not going to call up every think tank that spews out the fact that, oh, well, Medicare Advantage costs more than original Medicare to the system, which is also not necessarily true. We're going to get to that as my last point here under Medicare, which is that original Medicare, the federal red, white, and blue card, it does not have this maximum limit. So if you have $5 billion of healthcare services, right, if you have the red, white, and blue card alone, you don't have a financial maximum liability. You don't, if you have it alone. If you have Medigap, you don't have this problem. Why? Because Medigap pays for everything that Medicare doesn't. Let's just presume Plan G, Plan N, the two most popular plans. K and L have out-of-pocket maximum limits. Every Medicare Advantage plan has an out-of-pocket maximum limit. Must. So, when I hear pushback about Medicare Advantage, I never see the analysis, the figure to say, yeah, but every Medicare Advantage plan costs more because you've got this additional feature here that is not quantified in any of the quotes I've seen. Not one. This is a big deal, right? Because I'm a financial person, certified financial planner. The point here is so that if some very unexpected event, let's just say you're Mr. Average, and some crazy thing happens, you find, you have a genetic defect that doesn't show up, and now you have $5 million of costs. If you have a Medicare Advantage plan, every year there's an out-of-pocket maximum. This is glossed over / ignored in every statistic I have ever read about the fact that Medicare Advantage costs the planet more. Am I going to resolve this? No. But this is the key fact. See, it's killing me, the issue that people gloss over, and the fact that we've got all of these other issues. Yeah, those are still going to exist, right? Like I said, we're not getting away from this. But the fact is that it can also coexist, gives you an idea on how complicated it is.